Morning, everybody. Just give me a moment to give you access to record and we'll get started in a little bit.
Recording in progress.
You all should have access to record. If you do not, please just chat me and I will make sure to get you access. Also, I'm recording this and we'll be sending it out afterwards, but let's make sure you all have access for sure. All right, thanks, Josh. I'll get that to you.
I think, Brian, in the interest of time, as we wait for Dr. Foster, maybe I'll go ahead and start and then we can go from there.
That sounds good, Dr. White. Thank you. Give me 1 minute here and then we'll get started. Okay, since we're showing 10:32 in the interest of everybody's time, I wanted to introduce Chief Clinical Officer from Valleywise Health, Dr. Michael White, to give his briefing. And then directly following, we've been receiving some questions about the lightning strike at the Grand Canyon and one of those patients being treated at the Arizona Burn Center. So Dr. Kevin Foster will follow Dr. White. But with that, I'll turn it over to Dr. Michael White from Valleywise Health.
Good morning, everyone, and thank you for joining us this morning around our update COVID-19 within Valleywise Health and here within Maricopa County. Certainly, as we are seeing throughout the community and throughout the country, we've had an increase in the number of COVID-19 disease positive patients that we are seeing seeking medical care and requiring hospitalization. What we are noticing in this trend is this is predominantly those folks that are presenting for hospitalization and acutely ill are those that have chosen not to be vaccinated, for whatever reason around this, to do this. We are starting to see more patients. Our census today within Valleywise Health, we have 12 patients in the medical center, a number of which were in the ICU, which is a significant change for us. Prior to the last 2 weeks, the majority of the patients that we had been seeing had relatively moderate symptoms, not requiring that ICU level of care. That has certainly changed. We're starting to see people more acutely ill, require more resources around this, demonstrating that COVID-19 virus is still present within our community. We're starting to see more folks, which leads us to make the assumption that that Delta variant, that more contagious, more virulent variant of the virus is now, becoming stronger presence within our community. What is important for us now And what we need to see going forward is we have tools that are available to help us not see a dramatic increase in the number of patients that we're treating with severe complications from COVID-19 disease. And that's vaccination. Over 180 million Americans have been vaccinated against COVID-19 disease. Over 6.7 Arizonans have been vaccinated against COVID-19 disease. Through all of these, there has been very little complication or side effect from receiving this vaccine. And what we know is those that have received the vaccine, we have seen very little of those patients be hospitalized. I will tell you today within Valleywise Health, none of our patients that are acutely ill were vaccinated at this point from this. We need to continue to work to educate folks that we have this tool available. It's readily available in the community. Vaccination, is a way to develop immunity against this disease and prevent these severe complications and potential hospitalizations, especially with the more virulent Delta variant being present within our community. Also, through this vaccination strategy, it will help us, get more folks immunity, which could then prevent this virus from mutating into other variants that may even be more virulent than what we're seeing today. We just need to continue to do this. I would encourage those folks, if you are ill, have, respiratory symptoms, much like we've talked about throughout the entire pandemic, certainly consult with your healthcare professional around that. Make sure that you're staying, away from others and staying home if you have those symptoms. I can continue and encourage folks, if you have those symptoms, to get tested. Vaccination is a way to develop this disease so that we know if individuals are able to be isolated and be tracked, so we can make sure that we're providing, that safe care and not having spread of this virus within our community and of that going forward from there. Certainly, we know that, again, that this virus variant that we're seeing in the community is more virulent now than it has been. I would encourage, if folks are comfortable, as you're going into places that may be congregate, with a lot of individuals, where the ventilation may not be adequate. It is not, unsound to be wearing a mask in those areas, even though that you may not be required to do so. That would provide some protection, especially amongst those that may or may not be vaccinated in those types of environments. That ends my remarks this morning. I'm going to step aside. I'm going to let Martha translate for me, and then I'll answer some questions, and then I'll pass it over to Dr. Foster. So hang on one second as we switch spots.
Buenos días a todos. Gracias por estar con nosotros aquí el día de hoy. Agradecemos su presencia y vamos a dar una información. Este va a ser un resumen de la información que acaba de dar el doctor White ahorita. Bueno, continuamos viendo aumento en los casos de COVID-19 aquí en el condado de Maricopa. Hemos visto también, además, un incremento en los pacientes que están buscando ayuda, de repente que tienen síntomas y que necesitan de repente ya ser hospitalizados. Hemos visto que las personas que han estado hospitalizadas aquí dentro de Valleywise son personas que tienen problemas médicos y que no han sido vacunadas. El censo el día de hoy aquí en Valleywise es de 12 pacientes, ¿verdad? Hace 2 semanas estábamos viendo pacientes con síntomas moderados. Eso cambió. Desafortunadamente en estas últimas 2 semanas eso ha cambiado. Estamos viendo pacientes que ahora requieren hospitalizaciones. El virus continúa presente en nuestra comunidad. Esto hay que tenerlo muy, muy en cuenta. Y además, pues la cepa Delta está aumentando, está presente y está aumentando. Y sabemos que esta cepa es mucho más contagiosa, ¿verdad? La respuesta a todo esto va a ser la vacuna. La vacuna es el mejor antídoto que puede existir para combatir al COVID-19. 180 millones de americanos ya han sido vacunados. De esos 180 millones, 6.7 millones de arizonenses han sido ya vacunados. Sabemos que las personas que de repente han sido vacunadas y de repente presentan algún tipo de COVID son personas que tienen menos complicaciones, ¿verdad? Hasta este punto, los pacientes que tenemos hospitalizados han sido pacientes que no fueron vacunados. Así es de que como comunidad necesitamos seguir trabajando en la educación y decir al público que la mejor manera de combatir esta enfermedad o este virus va a ser poniéndose la vacuna, ya que esta nos da la inmunidad que se necesita para no tener complicaciones graves y además nos va a ayudar para que más adelante no se mute algún otro tipo de cepa. ¿Qué podemos decirle a la gente? Bueno, si hay personas que tienen problemas respiratorios, que están teniendo algunos síntomas, hable con su doctor, quédese en casa, aíslese en casa. Esta va a ser la manera, ¿verdad? Como vamos a evitar pues enfermarnos. Otra de las recomendaciones es, si usted se encuentra en un espacio cerrado, use mascarilla, aunque no sea requerido, especialmente si son personas que no han sido vacunadas. Muchísimas gracias.
Thank you, Martha. All right, I will be happy to answer a few questions this morning before I hand the reins over to Dr. Foster. You guys can go ahead and unmute yourselves and ask.
Dr. White, Josh Sanders from Channel 12 News. Can you hear me?
I can, thank you.
Okay, so, we've seen in the last week 114% increase in daily cases here in Arizona. That's currently third in the country. You yourself have said that the vaccine works, but yet we're still seeing disinformation put out there. We're seeing vaccine hesitation. What is your message to the public in terms of the vaccine and its ability to prevent COVID-related serious illness and death? And then the second part of my question is it getting time to where we need to have another conversation as a state with Dr. Chris, with the governor, in terms of preventing, more cases to, especially with the Delta variant, to continue?
Both good questions, Josh, around this. So certainly around vaccine and vaccine hesitancy. Again, we've seen over 186 million Americans that have received vaccine around this. And we know that the side effects of vaccine have been very minimal around it. And certainly as you look at the data across the country, those that are now becoming hospitalized or having severe complication really have been this unvaccinated population. Therefore, my encouragement is, consider getting vaccinated if you have chosen not to do so. We know that this variant that's circulating in our community is now more contagious, it's more virulent, and those that have not been vaccinated have those severe COVID-19 disease symptoms that often may require you to have, complications requiring hospitalization, and unfortunately, the ultimate complication in death. We have this tool available. We need to make significant use of this tool. Certainly, as we've seen the number of cases rise within our community, to your point, here within Maricopa County, we're at a case rate of over 114 cases per 100,000, which is the highest we've been in a number of weeks around this. We need to make sure that we as a community are doing the things to prevent this transmission. Again, if you're ill, stay home around this. Talk to your healthcare provider about getting tested so we know whether you have this or not. Certainly, do things to keep your hands again clean around it. And again, I would argue that, if you're going to be in confined spaces and you don't know the vaccination status of those around you, it does not hurt to wear a mask. It will help protect you, and those protect others from you if you're asymptomatic and carrying the virus.
One follow-up. So, I was in your COVID ICU when at the peak of it. I saw how worn out your staff were. So what would be your message to the governor, to ADHS, to the public when it comes to the vaccine and it working? How do we engage those people that are just hesitant or believing the disinformation that's out there?
Certainly, again, we have the data that the vaccine is safe. Certainly, our healthcare delivery organizations are tired. I will never pause and hesitate to congratulate and praise the resilience of our team to be able to rise and care for all of the folks, from our peak surge last July to what we saw in November, December, January of this last year. And now with the rise and uptick of cases that we're seeing now, the team rallies, but they are tired, from this. We also have those that are just seeking routine care within the system that may have been, deferring their care from the pandemic. So we're seeing a large volume of patients. We do not need to see another large spike within our communities of this disease when we have this tool available. I would encourage folks to continue to read from reputable sources, the CDC, the scientists that are putting out the information around the safety and the efficacy of how well this vaccine works, and encourage those folks to get it. Peter?
Hello, Dr. White. Thank you. So Banner, as you know, has mandated vaccines for all of its employees by November 1st. Will Valleywise mandate vaccines, coronavirus vaccines, for all of its employees and contractors in the foreseeable future? And what would the deadline be?
That's a wonderful question. We're evaluating that currently. We certainly congratulate Banner for taking this step around mandating vaccine and vaccination for employees within the health system. Certainly here within Valleywise Health, we're taking that into consideration. And unlikely, we'll hopefully consider moving in that same direction here within the next few weeks.
Any outbreaks among your staffers at this point?
It's a good question. As I think about that and as I report that, we certainly have seen intermittent employees and team members that have had COVID-19 disease and have been positive. We do not have any employees out today with COVID that I am aware of.
And how many employees do you have at Valleywise, and any idea how many contractors you might have?
So we have over 4,800 employees within the Valleywise Health system that are employed directly by Valleywise Health, and probably another 1,500 contracted services around that, excluding the work we're doing around Prop 480 and the construction through Care Reimagined.
Any idea when a final decision could be reached about mandating vaccines?
I expect it to be quite soon.
And masks, I'm sure that's still mandated amongst staffers, employees, and contractors. Is that correct?
Correct. The CDC has been very clear about masking within healthcare delivery settings around this. So we continue to have masks, within the organization, within Valleywise Health, in all of our clinical areas, and actually in all of our administrative areas as well around that, to prevent, us from being worried about transmission of this virus.
Thank you, Dr. White.
You're welcome. I'll take one more question, then I'll let Martha translate as she's over here trying to keep up with me. Well, perfect. I'll take that as a pause and I'll let Martha come in and translate, and then I'll likely hand the reins over to Dr. Foster. Thank you, Martha.
De regreso nuevamente con un resumen de las preguntas que se le estaban haciendo al doctor White, y una de ellas era sobre el aumento de casos, sobre todo que hemos tenido aquí en Arizona, ¿verdad? 100%, hay un aumento del 114% en los casos. Somos el tercero en la nación en tener más casos, y aún así y aún así las personas aún rehúsan vacunarse, ¿verdad? Le preguntaban al doctor qué es lo que él sugirió, qué es lo que él recomendaba. Bueno, se sabe hasta el momento de fuentes muy buenas que los efectos secundarios de la vacuna son leves y tienen mucho más beneficios para ayudarnos a prevenir lo que ha sido la enfermedad del COVID, o a no, en caso de que nos diera la enfermedad, pues no tener esos síntomas tan fuertes, ¿verdad? Las personas que no han sido vacunadas son las personas que hemos visto más enfermas y que requieren hospitalizaciones. Nuevamente el doctor dijo que hay un aumento de 114 personas por cada 100,000 habitantes. Entonces, como comunidad debemos de trabajar unidos para evitar la propagación de este virus. Usar mascarillas sigue siendo una protección. Entonces, el mensaje al público sería, busquen información que sea confiable, lean, ahí van a entender, van a saber que la vacuna es segura. Y nuevamente, tenemos que seguir trabajando como equipo para evitar lo que pasó anteriormente, como fue noviembre, diciembre y enero, ¿verdad? Banner, parece que el sistema de salud Banner ha requerido ahora o requiere que todos sus empleados tengan la vacuna contra el COVID-19. Y la pregunta para el doctor era si Valleywise también iba a tomar la misma dirección que tomó Banner. El doctor acaba de decir que él aplaude el esfuerzo que está haciendo Banner también y que también estamos hablando para considerar tomar la misma dirección que ellos han sido. En cuanto a empleados, si tenemos empleados con COVID-19 o que han dado positivos, bueno, hasta el momento sabemos que sí ha habido personal que ha dado positivo, pero hasta el momento en este momento no sabemos quién esté así. Somos un sistema de salud que tiene más de 4,800 empleados dentro de Valleywise, aparte más de 1,500 que son personas que son contratadas. Y esto sin contar a las personas que ahorita están trabajando en hacer las nuevas instalaciones. Entonces, esperamos pronto tomar la misma dirección que tomó Banner y esperamos anunciarlo también pronto. Nuevamente, quiero reiterar la importancia del uso de las mascarillas. Como ustedes pueden ver, nosotros seguimos usando las mascarillas. Aquí me pueden ver con mascarilla porque es una cosa que seguimos haciendo para evitar la propagación de todo esto.
For my portion, I just want to thank everybody again for, continuing to carry the message, around the wonderful work of the team here at Valleywise Health to be able to care for all of our patients, especially around this time of COVID-19 and the increasing cases that we're seeing. At this time, I have the pleasure of introducing Dr. Kevin Foster, who's the director of the Arizona Burn Center here at Valleywise Health, to give an update, on one of our situations that we've been taking care of from recently at the Grand Canyon. So I'll hand this over to Dr. Foster this afternoon.
Good morning, everyone. My name is Kevin Foster. I work at the Arizona Burn Center, Valleywise Health. And first of all, I'd like to just take a very brief moment to congratulate and thank all of our healthcare providers and our administrators who have really done a remarkable job during this really difficult time in the pandemic. The Burn Center has remained open. We will remain open. We're actually very busy, busier than we